GE has a workshop or what? GE have a symposium for GE. Okay, thank you very much.
Ti ho presentato. Mettiti meglio. Allora dovete bene adesso di tagliare.
Posso parlare?
Dici in inglese.
Could I speak?
We are listening, ma'am. We are listening now. We are with you. She doesn't hear me, huh?
Yes.
Is that right? Okay, let's start. Start, please. Start the talk, please.
Okay. Good morning. Thank you, the moderator, for giving the floor. I would like to greet you and thank the organizer for the invitation addressed to me. The topic that I speak to you is reversible electroporation in the management of prostatic cancer. Our experience about the reversible electroporation has begun in the 2013, and we started to treat the local advanced pancreatic cancer. And in the last years, we applied this technique on the prostate cancer. Development of the reversible electroporation started in the 2012 and FDA approved this system for treatment of soft tissue ablation. Subsequently, reversible electroporation technique has developed rapidly in tumor ablation field several years later, and in the 2017 NCCN guidelines recommended this technique for treatment of pancreatic cancer. Nowadays, irreversible electroporation is used for tumor ablation in more than 100 cancer centers in worldwide. And before to speak about our experience on the irreversible electroporation on prostate cancer, I want to show you different application of this technique. Irreversible electroporation can be used to treat all solid tumors, and many studies have demonstrated that most effective of irreversible electroporation is in treating locally advanced pancreas, but many studies have demonstrated that this application also on the prostate cancer and liver cancer, and also kidney cancer that occur close to critical structures, including blood vessels, nerves, and biliary tract. This is our first experience on the pancreas. I want to show you only one image to demonstrate the position of the needles. Every needles works, the needles of the reversible electroporation works in tandem, and it's necessary to use a couple of needles to treat a couple of needles, minimum 2 needles until 6 needles. And this is the follow-up after treatment, and you observe in this perfusion CT that the lesion treated with the reversible electroporation is completely avascularized. This slide is purely physics and describe the mechanism of irreversible electroporation. Irreversible electroporation is a local regional therapy that involves delivery of electrical pulses that involves delivery of electrical pulses to tissue, destabilizing the cell membrane. The process consists of the delivery of high intensity, ensured duration electrical pulses to the cells, and these changes in the lipid bilayer of the membrane called reversible electroporation. But if we modify the parameters and increase amplitude or timing, they induce transmembrane currents that are larger and determine breakdown of the cells. And so the advantages of this technique is, first of all, the tumor cell apoptosis. We define irreversible electroporation as a non-thermal ablation, and it's not affected to its sink effect. And we prefer to adopt use this kind of technique respect other kinds of ablation because protect vital structures surrounding the tumor, and is more precise respect other ablation treatment, and in particular kinds of treatment of cancer, in particular for pancreas, is possible to combine this technique with chemotherapy. In our experience, we use a different device, and in the last years, we use the Surgnova device that has a more compact design respect other device for forms, compact for design forms, portable generator, and the most important advantage of this device respect other device is the availability to real-time temperature detection. Thanks to the built-in thermocoupling chip, realizes the real-time temperature monitoring and is more stable and safe. In fact, during the procedures, we never observe the block of the machine. The incidence of prostate cancer is increasing worldwide, and established treatments is radical prostatectomy or radiation therapy aimed to treat whole gland, but with side effects such as impotence, incontinence, and potential damage to the rectum and bladder. In our experience, we observed that using the reversible electroporation, we reduce these reduced side effects. There are many different focal therapy technology, has, high intensity focused ultrasound ablation, focal cryotherapy, focal brachytherapy, but this technique, we think that is more suitable for the treatment of prostate cancer because it's not affected to its sink effect. But it's important to underline also the pitfall that we have using the irreversible electroporation. The first is electric field configuration strongly depends on the tissue heterogeneity of the gland, and it's important to consider that prostatic cancer is often characterized by multifocal, peripheral, asymmetric, and non-spheroidal, and is possible to observe capsule infiltrating. And so also to plan this kind of procedures, we have to consider these pitfalls. It's fundamental. Another important thing to underline is that before perform this kind of procedures, it's fundamental to adopt integrated imaging. And so in the literature has demonstrated that it's possible to plan the intervention joining different modalities technique. For example, it's possible to study the lesion joining the ultrasound imaging and MRI, or MRI and PET-CT. It's important to identify well the side of the lesion to plan the position of the needle inside it. As I said before, during this procedure, it's possible to choose minimum 2 needles until 6 needles. The needles works in tandem, and the distance between needle doesn't has to be 2 millimeters. You have considered that every needles cover 2 centimeter parts of the gland for every side. And another important concept of this procedure is that the patient, after positioned in the bed and perform a general anesthesia, has to place in a lithotomy position, and the urethral catheter is inserted. Following patient positioning, the next phase of this procedure is the visualization of the treatment field. and it's possible to visualize in our experience very well the lesion before with a transrectal ultrasound probe that is inserted in the prostate's three-dimensional measures, and is important to identify the anatomical landmarks, including urethra, urinary bladder neck, prostatic seminal vesicles angles, and external sphincter is fundamental. And the protocol that we adopt usually to treat the prostate cancer is to adopt a current of 25 milliampere, a voltage of 2,500 volts, and a needle exposure, as you see in this slide, length has to be in the range from 15 to 20 millimeters. After insert the needle inside the gland, it's important to perform a test, the pulse test, to check for four muscles paralysis, as unwanted muscle contractions can alter the position of the needles and change the ablation zone. After this pulse test, it's possible to begin the treatment. About the outcome of this patient after the irreversible erythroporation treatment, in this systematic review has demonstrated that the outcome is good, and after this treatment has demonstrated that we have less complication respect the prostatectomy, and remains a doubt about the surveillance. Surely, after this treatment, it's important to perform MRI to evaluate the ablation area treated with irreversible erythroporation, and it's fundamental also to repeat the biopsy. This is an example of our experience with the Supernova system, and as you see in this image, we use ultrasound to position the needle inside the lesion. But in our experience, we integrated this kind of imaging with the CT, because we think that the CT is a more quick examination that allows us to determine the correct position of the needle inside, in different planes inside the gland. This is an example of one of our treatments, and in this case, we prefer to cover all the gland and not to perform the focal treatment. In what way? In this case, you observe that we put 3 needles in the left side and 3 other needles in the right side. We subdivide the entire gland in 2 parts, and we cover before the right side, and then we perform another treatment subsequently in the other side, because we think that the prostate cancer is an organic disease. And this is the volume rendering reconstruction that demonstrates how it's important and fundamental to verify the correct position of the needle inside. This is the coronal view. We can follow the position of the needle in different planes. And this is another treatment that we perform. In this case, we prefer to perform a focal treatment. We put 2 needles inside the gland, and this is the follow-up that, thanks to the CT scan, we perform subsequently after treatment. And the signs that you can appreciate is the fine bubble air inside the area that we treat with the irreversible erythroporation. This is another example of treatment. In this case, we decide to put 2 needles inside the gland, and it's fundamental to preserve the urethra and the distance between needle respect the urethra that as not to be superior 4 millimeters. The goal of treatment of this technique is to provide a good oncological control whilst preserving the patient's quality of life. But 2 challenges that remain that remain for focal therapy, that are the selection criteria. The selection criteria for men that would most benefit from this treatment, and the appropriate follow-up protocols that we have to adopt. And another important aspects that probably with other studies is important to clarify is the efficacy of the reversible electroporation for radiorecurrent prostate cancer. At the conclusion of this presentation, we can say that irreversible electroporation treatment for the prostate cancer is safe and feasible for primary local treatment and is a good alternative treatment to intraoperative ablation. And surely, but it's important to clarify the point that I described before, is necessary to increase the study with the other trials. Thank you for the attention.
For the interesting interventional procedures of the prostate. And now we come to close our session. And lastly, only the GE symposium will present a small talk for us.